name's Hayden. I'm a student physical therapist, and would it be alright if I palpated some structures on you today?
Yeah, no problem.
Okay, thanks. Okay, first, you're going to be palpating C2, which we can find underneath the occipital bone. There's a little bit of space for C1, a little bit harder to palpate that spinous process, and then we can find C2. We can pull them into some passive extension there and feel that a little better. This is important to find because this is the attachment for the upper trapezius as well as the erector spinae muscles. Next is C7 and C6 spinous processes. C7 sticks out on most people, and I can find it right here. For C6 spinous process, we feel a little bit above, and I think I have it here. Will you go ahead and flex your head? Go and bend forward. Yep, I have it there, and when he extends his head, it kind of disappears on me, so that's how I know I found C6. These are important to find because, again, they are the attachment for the upper trapezius muscle, as well as C7 kind of is the marker between the spinous or the C spine and the thoracic spine. Okay, next is the facet joints in the C spine. We can find those moving laterally, kind of going through this the paraspinal gutter, and then we can find it. They're kind of tender on most people. I'm sorry, I don't want to push too hard. And we can kind of feel those bumps on the side of the neck there. This is important to find because these facet joints stabilize the C spine a little bit better, and they can also help us find those transverse processes on the C spine. Next is the first rib. We can just kind of move down until we find a hard end feel there, and I have it right there. Maybe a little bit tender to palpate, but we can move down and we can find that also underneath the clavicle next to the manubrium as well. This is important to palpate because it is the attachment point for the subclavius muscle as well as the a couple of the scalene muscles. Okay, next is the AC joint. To find that, we will move along the concave portion of the clavicle until we find the acromial end, which is a bump, which I'm finding right there. Once we roll off that bump, we found the AC joint. The AC joint is the location for the acromioclavicular ligament, as well as this is the place where you get a separated shoulder. You can get that by falling directly on your shoulder sometimes. Next, I will palpate the subacromial space. So after the AC joint, we find the acromion, kind of flat bone there, but if we roll laterally off of that, we fall off of the acromion and we found the subacromial space. In the subacromial space, this is important to find because there's a subacromial bursa, which can become inflamed, and also in this space is the supraspinatus muscle, which can become impinged, and there can be a lot of pain for throwing athletes right in that spot. Okay, next is the spine of the scapula, which we can kind of move back to the acromion, and we can just kind of palpate that bony structure all the way back, and we kind of roll our fingers to kind of confirm that that is the spot of the spine of the scapula. This separates the supraspinous fossa from the infraspinous fossa, where the supraspinatus muscle and infraspinatus muscles are. Also, it separates the on the medial end here, the rhomboid minor from the rhomboid major muscles. Rhomboid minor being above and rhomboid major being below it. Okay, next is the coracoid process. The coracoid process can be found anteriorly in the concave portion of uh, the clavicle, and I'm finding it right, hold on, it's right there. It's a little tender to palpate, and this is important to find because it is the attachment point of 3 muscles, including the coracobrachialis, the pectoralis minor, as well as the biceps brachishorten. Next is the greater tuberosity of the humerus. That is at the proximal end of the humerus in the most anterolateral location. We can kind of roll around there and we can find a big bumpy protuberance there in the bone. This is important to find because it is the location for 3 of the rotator cuff muscles, namely the supraspinatus, infraspinatus, and teres minor muscles. Okay, next we're going to find the medial epicondyle, which let's have you bring your arm out here. We can kind of feel the shaft of the humerus, that supracondylar ridge, and then we come out and it protrudes pretty medially, and that is the medial epicondyle. This is important to find because this is the attachment point for all the wrist flexor muscles, including pronator teres and flexor digitorum longus. Okay, next is, let's kind of scoot over real quick, is the lateral epicondyle, which we can kind of do the same. We find the shaft of the humerus, the supracondylar ridge, and then we find the lateral epicondyle, which is right here. This is important to palpate because we have all the wrist extensors attached here, and this is also the way best or easiest to find the radial head, which we're going to find next. And the way we do that is we move distally into the joint space, and then even further, and then we find that radial head, and we can kind of confirm we found that radial head by kind of pushing the patient into a pronation and supination, and we can feel that head rotate. Also, we can kind of grab that and move that. It's a little hard to move, but we can move that head. That is important to find the radial head because we can find the annular ligament and see if that is in the proper place, as well as just the motion of that radial head and making sure there's no limitation there. Okay, next we're going to do the scaphoid bone. We're going to go ahead and extend all your fingers, particularly your thumb. We can move down the radius bone over the radial styloid, and we find this anatomical snuff box. And in there we can find the scaphoid bone. This is important to palpate because this is a common bone. This bone is commonly fractured when someone falls on an outstretched hand. Also, we can find the tendons of the abductor pollicis longus as well as the extensor pollicis longus. Next is the triquetral bone, which we find over here on the side of the 5th finger. Let's move down the keep here. We'll move down the shaft of the ulna. We find the ulna styloid process. We fall into the joint space, and we can find the triquetral bone. Also, we can move into radial deviation, and that'll protrude even further for us. This is important to palpate because this is the attachment point for the flexor retinaculum on the medial side, as well as this bone can help us kind of find other carpal bones in that area. Okay, next we're going to palpate the knee joint line, and we can find that by finding the lateral portions of the patella, moving to the apex, and then moving laterally, and we found the joint line. This is important to palpate because we can find both the medial and lateral meniscus as well as the medial and lateral femoral condyles. Next is the fibular head, which we can find by finding that tibial lateral epicondyle and then moving posteriorly and inferiorly, and we have found the fibular head. It sticks out quite a bit there. This is important to find because this is an attachment for the LCL, or the lateral collateral ligament, and the biceps femoris. Okay, next we're going to palpate the liver, and the best way we can do that is we find the inferior portion of the costal portion of the inferior ribs here, which I have here, and then we can kind of push in there and we can find that firm end feel of the liver. And this is important to find for non-skeletal muscle reasons, as well as for helping us find the kidney, which we can find in that area. Next is the anterior superior iliac spine. First we want to find the iliac crests, and then we can follow those anteriorly until we find the most anterior portion, which I have both here on both sides. That's important to find because that is the attachment for the inguinal ligament as well as the sartorius muscle. Okay, next we're going to palpate the medial femoral triangle. First, we want to find the adductor longus, and the way we're going to do that is we're going to ask our patient here to push inward here against me, and I'm push in there and I'm going to hold against you. Okay? And we can palpate right up there, and we can find that adductor longus, the lateral portion of that. Go and relax, thanks. And then we have found the bottom of the triangle, and we can move up and we can kind of feel just soft tissue here, no muscle in this area. And this is important to find because that is where the femoral artery, nerve, vein, that is their location there. Okay, next we're going to go to the talus. Talus, we can just go down the tibial crest here until we go to the joint space, and then we can find that talus dome, and we can find it even better if you push your toes down here for me. Yep, and we can find that, we can feel that dome even better. That's important to find because it is the attachment point for both the anterior tibio-talar ligament as well as the anterior talofibular ligament, which we're going to feel here next. Go ahead and push your toes inward as well. Thank you. And by doing that, we can feel that anterior talofibular ligament right there. We can feel those fibers there. And that's important to find because this is a commonly sprained ligament in particularly in basketball athletes, and this can also help us find the other ligament right next to it, the calcaneofibular ligament. Okay, next is the base of the fifth metatarsal, which we can find here. We can just kind of push our fingers until we feel a bone sticking out here, and that is going to be the base of the fifth metatarsal, just right there. That is important to find because this part of the bone can be fractured quite easily with an avulsion fracture, and it's also the attachment point of the fibularis brevis and tertius muscles. Next, we're going to do the navicular tuberosity, which we can find by moving inferior and anterior of the medial malleolus, and we can find a pretty large bump here, not too far from the medial malleolus, and you can feel it really well inferiorly. That is the navicular tuberosity. This is important to find because this is the location of the spring, an attachment point of the spring ligament, as well as posterior tibialis muscle. Okay, next is the greater tuberosity. We can find it by kind of rubbing our palm right around the hip area here, and we can feel that it is the most lateral portion of the hip. That is the greater tuberosity. It is the attachment point for the gluteus medius, minimus, as well as the hip intrinsic muscles. Is the posterior superior iliac spine. We can find that just by palpating the iliac crest and then following it down until we find the most prominent feature posteriorly, and that is the PSIS there. This is important to find to help do some pelvic alignment and see if they're both aligned. Also, it can help us find S2 spinous process, which I have about right there. I'm going to use that reference point right now to help me find L5 spinous process, which I have right there. L5 spinous process is important to help us distinguish between the lumbar spine and the sacral spine, as well as it's an attachment point for latissimus dorsi. Okay, next is the inferior lateral angle of the sacrum. We already found the sacrum at S2, and we can move down and laterally, and then we can kind of push in, and we can feel that hard end feel there of the inferior lateral angle as we push inward and a little superiorly. That is the attachment point for both the gluteus maximus and the piriformis muscles. Okay, next is the 12th rib. We can find that by finding the iliac crests again and then moving into the soft tissue above it until we find the 12th rib, which I have right there. And this is important to find because it is an attachment point for the quadratus lumborum muscle, as well as we can follow this up and find the 12th vertebrae. And last is the ischial tuberosity. We're going to ask our patient to extend his leg, go and lift your leg up. Okay, then we can find that gluteal fold visually, and then we can go and relax, and then we can push in there and find a pretty firm end feel right there, and that would be the bony part of our butt, the ischial tuberosity. And that's important to find because that is the attachment point for all of our hamstrings, biceps femoris, semitendinosus, and semimembranosus.